Have you ever wondered if the cramps you're feeling are from your period, or if they might be an early sign of pregnancy? Figuring out the difference can be confusing, but it's crucial to know. In this video, we'll break down the key differences between period cramps and pregnancy cramps to help you understand your body better. Understanding period cramps. Period cramps, also known as menstrual cramps, are a common experience for many women. These cramps usually occur in the lower abdomen and can start 1 to 2 days before your period begins. Let's delve into what period cramps are like. Timing. Period cramps typically begin a day or two before menstruation and continue for a few days once your period starts. They often follow a predictable pattern each month. Location. The pain is usually felt in the lower abdomen, but can also radiate to the lower back and thighs. It's a dull, throbbing pain that comes and goes. Severity. The intensity of period cramps can vary from mild to severe. Some women may experience only a slight discomfort, while others might feel intense pain that interferes with daily activities. Accompanying symptoms. Along with cramps, you might experience other symptoms like bloating, headaches, and mood swings. These are all part of the premenstrual syndrome, PMS, that comes with your period. Duration. Menstrual cramps generally last for 2 to 3 days. However, in some cases, they can persist throughout the entire menstrual period, which typically lasts 3 to 7 days. Understanding pregnancy cramps. Pregnancy cramps can be tricky to identify because they can feel similar to period cramps. However, there are some key differences that can help you distinguish between the two. Timing. Pregnancy cramps can occur as early as a few days after conception. These cramps are often one of the first signs of pregnancy and can happen before you even miss your period. Location. Like period cramps, pregnancy cramps are usually felt in the lower abdomen. However, they can also be felt in the lower back and can be more widespread. Severity. Pregnancy cramps are typically milder than period cramps. They feel like a slight pulling or stretching sensation in your lower abdomen as your uterus begins to grow. Accompanying symptoms. Pregnancy cramps are often accompanied by other early pregnancy symptoms such as nausea, breast tenderness, and frequent urination. These symptoms are caused by hormonal changes in your body. Duration. Unlike period cramps, which have a clear start and end, pregnancy cramps can be more intermittent. They may come and go over the course of several weeks. Key differences between period and pregnancy cramps. To make it easier to understand, here are some key differences between period cramps and pregnancy cramps. Timing. Period cramps occur around the time of your menstrual cycle, while pregnancy cramps can happen anytime after conception, even before a missed period. Severity and sensation. Period cramps are often more intense and feel like a throbbing pain, whereas pregnancy cramps are usually milder and feel like pulling or stretching. Additional symptoms. Period cramps are often accompanied by PMS symptoms like bloating and mood swings. Pregnancy cramps, on the other hand, come with early pregnancy symptoms like nausea and breast tenderness. Duration and pattern. Period cramps follow a monthly pattern and last for a few days. Pregnancy cramps can be more sporadic and may continue for several weeks as your body adjusts to pregnancy. When to see a doctor. It's important to listen to your body and seek medical advice if you're unsure about your symptoms. Here are some situations where you should see a doctor. Severe pain. If your cramps are extremely painful and not relieved by over-the-counter pain medication, it's a good idea to consult a healthcare provider. Unusual symptoms. If you experience symptoms that are not typical for your period, such as severe back pain, heavy bleeding, or fever, seek medical attention. Persistent cramps. If you have cramps that persist for more than a few weeks, especially if you're also experiencing other pregnancy symptoms, make an appointment with your doctor to rule out any complications. Positive pregnancy test. If you suspect you might be pregnant and have a positive home pregnancy test, schedule a visit with your healthcare provider to confirm the pregnancy and start prenatal care. Understanding the difference between period cramps and pregnancy cramps can help you better manage your health and know when to seek medical advice. Pay attention to the timing, severity, and accompanying symptoms of your cramps to determine whether they are related to your menstrual cycle or an early sign of pregnancy. If in doubt, always consult with a healthcare professional for personalized advice and support. Don't forget to like and subscribe to our channel for more amazing content. Thanks for watching, and we will see you in our next video.